And could you be a candidate for weight loss surgery? Find out right now on San Diego Living.
Good morning and welcome to San Diego Living. I'm Greg Phillips. If you or someone you know is overweight and maybe thinking about surgery, you want to know what your options are. Dr. Julie Ellner is a bariatric surgeon with Alvarado Hospital and consults with people every day to help people shed the excess weight, literally giving them a new outlook on life. Good morning. Thanks for being with us this morning.
Thanks for having me.
All right. First, how do you determine who's a candidate for surgical weight loss?
The folks who should be considering surgical weight loss are people who have a BMI or a body mass index of 35 or more. Now, depending on how tall you are, that roughly corresponds to someone who's maybe 80 or 90 pounds overweight or more. Those are the surgical candidates. The diets are for people who maybe have 50 or 60 pounds to lose.
Let's talk about the options that are out there. I know there are several. The lap band. Explain, what it is and how it all works.
The lap band is one of the most popular operations right now for obesity, along with the gastric bypass. Those are the two most popular operations now. I have a model of the lap band itself. This is a model of the stomach, and the lap band wraps around the top part of the stomach. And the neat thing about the lap band is that it has a little reservoir, like an inner tube around the inside of the band that is inflated through this little button which sits under the patient's skin, so it can be tightened or loosened over time depending on the patient's weight loss desires and experience. Now, the gastric bypass is designed more for people who have perhaps 120 or more pounds to lose. This is best for someone who's maybe 80 to 120 pounds overweight.
And obviously, I mean, the band suppressing not the length, but the size of the stomach, therefore decreasing someone's appetite.
That's right. It squeezes around the top part of the stomach, which makes a patient feel full on a very small amount of food. But the other neat thing about the band is that it actually pushes on the appetite nerve, so it does decrease the patient's desire for food as well. The gastric bypass is better for people who perhaps have more medical problems that they're concerned about, like diabetes or hypertension. With those two diseases specifically, the gastric bypass makes diabetes and hypertension go away within 48 hours in 90% of people.
Wow. Now, years ago we heard, controversy about gastric bypass, that, there were some dangers. Still the case? Are there any health risks, to people that are thinking about getting this type of surgery?
The gastric bypass and the lap banding certainly are major operations, so they need to be approached from a serious standpoint. But they're not nearly as risky as they used to be, particularly with respect to the gastric bypass. It's safer than it ever has. It's actually been found that the risk of a patient dying from obesity is almost 10 times more than the risk of dying from the gastric bypass surgery.
Wow. Talk about how, weight loss surgeries impact a person's life after they have it.
I think the biggest impact is certainly with respect to the person's overall health. And now that people are concerned about the recession, everyone is watching their pennies, it's actually been found that the patient who is obese spends about $18,000 a year just on their obesity. And the surgery relieves that financial strain from the patient.
And that's obviously on food.
It's actually food, pharmacy bills, time off of work, that sort of thing.
Oh, wow. And talk about revision surgeries, because you guys do, and you were just kind of showing some of it, you guys do one of the newest types of revision surgeries and are the only ones in San Diego County doing it, right?
That's right. This is one of the newer types of revision operations. This is called the StomaFix. This is an instrument that I use through a couch of a gastric bypass patient. One point I'd like to make about this is that the follow-up care after a gastric bypass is crucial to train a patient how to use the surgery without inadvertently damaging it. Many patients dashed out and got the surgery over the past 5 or 10 years, which was the right thing to do, but they didn't get the follow-up care to allow them to keep their tool functioning properly, and through misuse, they have inadvertently stretched the pouch. So I can go in through the mouth with an instrument like this and take tucks in the stomach to re-shrink it and then teach the patient how to use it appropriately.
And follow-up care is so important after, you know, a major surgery like a gastric bypass. And of course, if you want more information, that you see the information, the number on your screen, 1-800 Alvarado. Dr. Julie Ellner, thank you so much for coming in today. Some great information for a lot of folks out there.
Thanks.
All right. Of course, for more information, go to our website, san diego6.com.